Hello, my name is Richard Newton and I'm going to be talking today reviewing the European equine flu epizootic and looking really at what lessons we may have learned from this. Next. The overview of the talk. I'm going to review equine flu, the virus and the way that it spreads. I'm going to present a short summary and reflections on EI in Europe in 2019. I'm going to look at racing's approach to the outbreak and the lessons that they may have provided for the rest of us. I'm also going to reflect on factors that may have contributed to the spread of EI in the wider UK equine industry. I'm going to look at how we might optimise future vaccination protocols. I'm going to look at whether we improved the way that we exchange information about disease, and I'll just close off with some concluding remarks. So what we're interested in here is influenza viruses and the way that they infect the horse. This cartoon here represents a flu virus, and on the outside of this are two important proteins, the hemagglutinin and the neuraminidase. Next. We can think of influenza as a wheel, and in the hub of that are the influenza viruses, which naturally form a reservoir within wild fowl. And this virus will spread out from there into other species, including the horse. We're aware of swine flu, human flu, dog flu, etc. Next. Horse flu, first, we became aware of the current influenza that's causing problems back in 1963, and this is a virus known as H3N8. But there have been other viruses, such as H7N7, first isolated in 1956, but which has probably now been eradicated from horses. Historical reports of disease almost certainly indicate that there have been other viruses that have come in, caused large outbreaks, such as the Great Epidemic of 1872 in the USA. And we've got to think that there may well be future incursions of other viruses, and we have to be prepared for that. There are 5 key facts that I think it's worth just emphasising here about flu. It's a highly contagious, rapidly spreading viral respiratory disease of horses, so a little bit like COVID in humans that we're seeing at the moment. But importantly, flu in horses needs chains of transmission to persist within populations. Where we have horses moving and mixing frequently and there is no vaccination to control it, then this is ideal for the spread. So we do use vaccination to prevent and control this infection, but those vaccine strains do need to be monitored and updated periodically. So it is true to say that flu will mainly affect non-vaccinated horses, but it can occur in vaccinated animals. Next. So if we think about EI infection, we have a healthy susceptible animal, it meets the infection, it then goes through short periods before it develops clinical signs. Next. And around that time it will become infectious. Those signs are often a temperature, a cough, a nasal discharge, and it will go off its food. That cough is important because that gets the virus out into the environment. Horses are usually not solitary animals, and therefore that gives the ability to spread this transmission elsewhere. Next. As I've said, and I would remind you, the horse flu does not have a carrier state, so it relies on these chains of transmission. An infected horse has to pass that infection on to the next animal or more than one in order for that infection to persist. Next. So we can see that we have one of these cycles of infection and they follow on from each other. Next. So each time we see this, the infection is passing on. Next. So the concept of the basic reproduction number, a concept that we're all now increasingly familiar with COVID, and this is the number of cases on average that one single case of horse flu will generate over the course of its infectious period, which is relatively short, only around 10 days, and in an otherwise uninfected population. That's why we call it naught. Next. So where R naught is greater than 1, then we get these chains of transmission extending, and where that is a high number, and maybe as high as 10, then we get rapid transmission, propagating epidemics. But if we can affect that number and reduce it less than 1, then the chains of transmission ultimately will die out and may well lead to the extinction of the disease entirely. Next. So this Brings us to what role can vaccination play when we're employing it? Well, the concept is that we want to take the healthy susceptible animal and move it from the left of this slide over to the right such that it's a healthy, immune and resistant to infection. Next. And we do that through vaccination, and in doing that we miss out the middle bit where the horse develops clinical signs and ideally is no longer infectious to other animals. Next. So in this way, vaccination will effectively reduce that R number, ideally below 1 and well below 1. It will therefore reduce the likelihood that we have a large epidemic, and it will increase the likelihood that that virus will in fact become extinct from the population. But we must remember that neither of those things are guaranteed because there are many other factors that are involved. Next. So if we look at the virus, this H3N8 that we've been living with since 1963, next. This chart here shows that at the top was when the first virus emerged, probably out of birds infecting horses. And moving down the slide towards the present day, it's gone through various different lineages, sublineages, such that now we really have two clades of virus circulating in different parts of the world, the Florida clade 1 and the Florida clade 2. Next. So if we now just look at some recent history of equine influenza in the UK, and we go back to 2014, next. 2014, we actually detected 31 outbreaks, which was a sort of recent record around that. And you can see from the map on the right, this was fairly widely disseminated across the UK. Next. And at this time, we thought that we may be on the verge of this virus starting to become even more important because the vaccines at the time didn't include this strain. But actually, to our surprise, the numbers of outbreaks gradually went down year on year. 21 outbreaks in 2015, next. 7 outbreaks in 2016. 2017, we had 5 outbreaks, next. And in 2018, we only detected virus in the UK on 2 different occasions, 2 outbreaks involved. And this was based on looking at over 800 samples looking for presence of the virus. Next. But to say that between 2010 and 2017, all the viruses that we were able to type were typed as the Florida clade 2 virus. And you could see year on year, they were obviously closely related, and it was persisting within the country. Next. But one of the outbreaks, the first one that we found in February of 2018, we were able to type that virus, and it was actually found to be a Florida clade 1 virus, different to what we'd seen in the previous years. The other one that appeared in April was in a vaccinated horse, and we weren't able to recover virus and type it. So we don't know what we were dealing with at that point. Next. But it was very clear moving very shortly into 2019 that we were dealing with a different problem, and it wasn't just ourselves, it was other countries in Europe. Next. We were dealing again with the Florida clade 1 virus. We ended up with over 200 outbreaks confirmed in the UK. Map on the left demonstrates the geographical distribution of those outbreaks over the year. We were, as will become evident, we saw 2 waves of infection, and flu was diagnosed in horses in every month in 2019 except one, and that was in September. Next. So in this slide, which I'm about to reveal, this reveals the weekly number of UK confirmed outbreaks that were laboratory confirmed. So the number of outbreaks there on the vertical axis and each week of the year as we go. Next. So what you can see on this slide is that early in January, we exceeded the total for 2018. We had a peak in February, a decline through March and April, but then this second wave took off, and then it declined, and we had very few outbreaks confirmed in the latter quarter of the year. Next. The maps here just highlight where geographically by county we were making these diagnoses. In February, we seemed to see a sort of spread of the virus down the western side of England. Interesting to note in these slides that Wales was really largely unaffected until we detected it in May, and then through June, July and August we did see outbreaks in Wales. Next. So looking at European cases, and in these situations, I've managed to get some data from other countries in Europe going right through to the end of May this year. And for this, I'm very grateful, thank you. Next, please. To contributions from Anne Cullinan at the Irish Equine Centre, Kees van Manen at GD Animal Health, Klaus Ostrider at the Free University in Berlin, and Roman Peo and colleagues with the Respay. Next. So here we've had a total now of 230 outbreaks in the UK. The Irish have reported 84. Next. In Germany, they had 33 outbreaks, and the red line around here demonstrates the geography of that. Very few, no outbreaks in the east or the south of the country, but largely along that border with the Netherlands. Next. The Netherlands itself has reported 58 cases. Not a very good image, I'm afraid, but those blue dots there demonstrate that they've had outbreaks really throughout the whole country. Next. In France, 62 outbreaks confirmed in a well-vaccinated population, and their geography really showed that this started along the border with Belgium, descended south, and then they saw a similar second wave themselves. Next. And we're not, whilst we are aware that flu was diagnosed in other countries and may have been diagnosed, we I'm afraid don't have many details for those. Next, please. So this next slide is going to show you the epidemic curves that I've taken based on the data that these people provided me. Obviously, the numbers of outbreaks are quite different, with the UK having the most. So important to say that what I'm representing here is the percentage of the country's total confirmed by month across 18 months from December 2018 on the left through to May 2020. Next. And so what this clearly shows, the black line is the UK. We saw 2 waves of this infection, and then it trickled out after that. The French, the light blue line, actually is a very similar pattern with 2 waves seen around the same time. The Irish, the green line, had an initial peak. They threatened another peak in May, but that really didn't come to anything, and then that died away. The Dutch is a different pattern. They started with a lot of diagnoses in December 2018, but then it gradually declined as the year went on. So a different pattern of disease there. Next. So going to the beginning of that and going back to January 2019, we saw this by the middle, just after the middle of the month. We diagnosed this in 4 different counties. We confirmed, as our French and Irish colleagues had already done, that we were dealing with the Florida clade 1 virus. And in fact, the 2018 total had been exceeded by the end of the first week of January. Next. So we in the UK saw increased EI activity very early in 2019 compared to all of 2018. Next. We were aware of increased activity in Europe as well as in the UK, and that they were all reporting the same Florida clade 1 virus as we were. Next. And we took this information to the British Horseracing Authority Veterinary Committee on the 24th of January of that year, and really alerted them that this pattern was looking different. It had a different feel to it. And on the basis of that, 6 monthly booster vaccinations were advised for racehorses going forward. Next. What was also clear and slightly worrying was that vaccinated horses were being confirmed with this infection, and this had been seen in Europe prior to us seeing it in the UK and in Ireland as well. And we didn't have to wait long after this meeting, because on the 4th of February we confirmed our first vaccinated horses with this infection. Those were horses in a pre-training yard several miles outside Newmarket. 2 days later, we confirmed flu in racehorses in Cheshire, and that's when the game started to change. So I'll just comment now, whilst I've got a chance, on vaccinated horses with EI. Next. In total, we actually confirmed through laboratory tests flu in 413 horses in UK EI outbreaks in 2019. Next. And we were able to evaluate their vaccination status. And whilst the vast majority of these were not vaccinated, over 70%, we do have 18% of these animals were deemed to be appropriately vaccinated based on their records. A small proportion, 4%, were lapsed vaccinators, so they had been vaccinated but had lapsed, and some we just didn't have the data for. Next. Of those 74, we only have data available with detail for 35. Next. And what we've been able to show with these are that the last vaccine administered in their schedule varied. 34% of those animals had received their primary course, but they were on average moving into sort of what we call the immunity gap. They were getting towards 4 months on average beyond that. V3, or the 5-month booster, as the data sheets have it, nearly a quarter of animals were in there. Again, many of those animals had moved beyond the 6-month mark. And we have those that had already received an annual booster or later booster, and there's quite a high proportion of animals fell into that bracket. What I would highlight there is some of those animals had very short periods since they've been vaccinated, and they were almost certainly exposed before they'd had a chance to respond to their last vaccine. So that's dragged that number, that mean time since last vaccination down. Next. The other information that we got from each outbreak was really the type of vaccine that had been used, and 25 of the outbreaks we had vaccinated animals, so that's 11% of the outbreaks. And these data relate to between January and August 2019. Next. So the next, please. We had data on 22 outbreaks. The important take home from this slide is that all 3 of the flu vaccine brands that were available in the UK at the time were in some way implicated in horses that were vaccinated being infected and shown to be infected with the eye. The 2 red brands there, Frequenza and Protec, are highlighted because they were known to contain a Florida clade 1 strain in their makeup. Quip doesn't, and therefore we would expect perhaps not be so well equipped to deal with the eye. So we had these vaccines not working as effectively as they could do, despite having the presence of those strains. Next. So going back to the fact that we had flu diagnosed in an active racing yard on the 6th of February, that really was a bit of a wake-up call for British racing, and the quite monumental decision was made that racing was cancelled, and that was from the day following that diagnosis being made. And racing closed actually for a total of 6 days, between the Thursday the 7th and the Tuesday the 12th of February, with racing returning the day after that. And the reason for this was that the racing network is so highly connected in the UK that it was clear that through just 5 race meetings where we had a suspicion that infected horses may have gone, that involved horses coming from 174 yards, and those yards together contained nearly 10,000 horses. So with an outbreak that may be starting to break through vaccination, we took a precaution, and we wanted to understand what that was. Next. And so that would allow time for racing to assess the situation in terms of flu. And as part of that, the Animal Health Trust had to quickly prepare for some increased testing, which we were planning to do afterwards. Next. So this slide here just represents the number of qPCR tests that are looking for presence of the virus that we conducted at the Animal Health Trust, starting at the beginning of the year on the 1st of January on the left, and going through to around the middle of February. And you see a large ramping up of testing. Next. From the time that first diagnosis was made, and particularly when racing resumed. In those last 11 days of this slide, there's around 4,500 tests being conducted. Next. So one of the lessons that we have to learn, I think, from the outbreak in 2019 is the need for scaling up of lab testing capacity. And this is obviously very pertinent to the way that COVID has been handled and the need for testing. Our testing was very much improved compared to previous very busy years in 1989 and 2003, and there were several things that allowed this to be facilitated. We were by then using a different design of swab, no longer the handmade swabs that you see there with the cross and on the left. We were now using commercially produced swabs, which could be ramped up in terms of their production. We were now relying on molecular techniques to detect the virus, and this allowed us to do much more high throughput testing, and bringing in research staff along with our diagnostic laboratory staff, working very closely with the BHA and some of their staff based and embedded with us, allowed us to respond to this. Next. So thinking about this, it is absolutely essential that we need to think about how we might deal with the threat coming from a completely novel strain for which we would not have vaccines. Is what we've got now enough? How would we deal with an avian influenza transferring into a horse for which we don't necessarily at the moment have a test and which we certainly wouldn't have vaccines? I think we need to think about that next, and it will require investment in both infrastructure and equipment. The slide here represents a robot that can work through the night and allow you to do far more testing. Next. So what lessons can we take from the way that racing dealt with EI in 2019? Next. Well, if we go back to that meeting on the 24th of January, racing heeded its earliest warning. It implemented 6-month boosters, and that I'm sure did help. It very quickly applied the principles that we're now familiar with COVID, of locking down, closed yards, it didn't go racing, it tested and it traced animals that may be at risk of being exposed, and it was using that information in order to inform policy about starting racing again and what it would do when it did restart. It also applied biosecure precautions on releasing that lockdown. So yes, racing was lost for 6 days, but when it came back, it was looking slightly different. Trainers had to declare that their runners were healthy. They had to take their rectal temperatures before travelling and declare those. Animals with clinical signs were getting tested. Racing identified that it had some weak links. This virus had not gone away. Sales pre-entry testing got adopted by the sales companies, and there was testing of or ban altogether on non-thoroughbreds on racecourses. The Royal Procession horses, the Mounted Police horses that would be attending things like Royal Ascot all got tested and were cleared before they were allowed on the racecourse next. So what resulted from that policy? Well, yes, 6 days of racing were lost, and I'm sure racing would actually love to have only lost 6 days of racing this year. But the Cheltenham and A-Tree festivals went ahead, and the flat season started and went ahead as well. So whilst that second wave was going on, racing was actually largely unaffected, other than these increased tests and actions that it put in place as a precaution. Next. But I think we have to look at whether we effectively communicated all these actions more widely in the hope that they would be adopted. So the Animal Health Trust next adopted really 5 basic protocols that it put out in communications, and this is what you see here, this sort of infographic, and that started soon after racing had resumed. We were advocating vaccinating, isolating, investigating, communicating, and obviously overall mitigating risk. Next. But unfortunately, history probably tells us that we failed to raise adequate awareness, as EI was still present and was still a threat in March and April. And while it looked like it was declining, we were conscious next that there could well be a second wave as horses started to move around the country, as they usually will do during the summer months. And we tried to mitigate this by supplying advice such as this infographic here to help people mitigate risks as they were using their animals next. So I think the conclusion has to be that some simple messages were either missed or blatantly ignored by horse owners and event organisers. And we are aware of some events which didn't seem to heed this advice and were on social media saying as much. And really, it was the important messages about vaccination, insisting on vaccination for events, and taking precautions with isolation when taking animals new or back onto premises. Next. So if we look critically, what factors may have helped the flu virus take off, particularly in that second wave in 2019? Next. Well, I think we have to conclude, and we were aware of this before, that there actually would be a low national vaccine coverage. Estimates will put that at somewhere between 30 and 40%. And we know from data from elsewhere in Europe that they have a much higher percentage of their horses receiving flu vaccination. And that would have contributed to the higher number that we've seen in this country. Next. It was disappointing that events were still going ahead. They weren't requiring vaccination as a condition of entry. And ultimately, as we went through June, we did see events being cancelled, as these headlines demonstrate. But ultimately, that was actually a positive step in disease control because it stopped the gathering of horses and then the dissemination of infection. It's unfortunate that it had to get to that point. Next. Clearly, there was a lack of preventive measures, particularly relating to new arrivals and event returnees. People were still buying horses. There were horses coughing at vettings, and yet they were still not being investigated and moving on to new premises. Next. Anti-vaccination rhetoric certainly got traction. We were aware of this through social media. People were very reticent, some people very loud and reticent to start vaccinating their animals. Next. And the arguments were made, and there are scientifically valid arguments why we would increase the frequency of booster vaccination. And these were very much, in some quarters, being questioned. And I must say that the compromise that was put in place by the BHA, ultimately moving from 6 months to 9 months, really did cause some confusion as people looked at racing as really the arbiter of what good practice should be. Next. So, learning lessons. How do we ensure future benefits from our vaccines? Because that's what we do rely on. They're the first line of prevention we have. Next. Well, perhaps we can improve our vaccines. We can look at the strains. Next. Well, at the moment, this has been looked at, and the panel that look at this are keeping this under review. And at the moment, there is, based on their established protocols and the way that they do this, there isn't actually sufficient scientific evidence today to recommend that a vaccine strain is definitely required. But that will be kept under review because we may only be a short time away from that. Next. So what about the booster vaccination interval? That really is something that we need to look at, and I'll spend a little bit of time going through that now. Next. So moving from annual to 6 monthly boosters was something that we recommended very early on, and we believe that it is scientifically justified. We were dealing with a 2019 virus, and the 2003 virus was in the vaccine, so that's a gap of 16 years. Next. So why would we want to boost every 6 months? Next. Well, we know from the way that flu vaccines work that they induce measurable antibody, and it's this that protects against infection. It actually stops the binding of the virus, stops entry, and will stop infection and disease if those levels are high enough. But as with all vaccines, those levels of antibody will decline with time since last vaccination, and that's when we will get animals being susceptible again. Next. We also note that not all horses will respond in the same way to these vaccines, so we have variation in vaccine response, as this slide on the right demonstrates. They're not all following the same pattern in terms of where they move on that graph. Next. So the truism is basically that horses will be less well protected at 12 months after their last vaccination compared to 6 months. And some animals will be better protected at that point than others as well because of that variation. Next. We also know that it's also, we look at outbreaks to learn learn lessons, and it's been identified as an important factor in previous outbreaks. Next. So this is some of our own work going back to the mid-1990s, outbreaks that occurred in limited way, but in thoroughbred racehorse racing yards in 1995 and 1996. Next. And that demonstrated, when you looked at the vaccination details, that the vast majority of the animals in these outbreaks had last been vaccinated more than 6 months previously, and that's published and written there. Next. More recently, in 2003, we had a large outbreak in Newmarket, and it was even more stark then. Next. In that the data demonstrated in that outbreak that animals vaccinated more than 3 months previously, not just 6 months, were at a 10 to 15-fold greater risk of going down with infection in that outbreak than those animals that had been vaccinated 3 months or less before the diagnosis. So not just 6 months, 3 months was important in that outbreak. Next. Our Irish colleagues have also shown the same. They've looked at factors contributing to outbreaks over there, and some of those have been in racing yards. Next. And in this slide, we have a total of 98 animals that were vaccinated, and 30 of those, so over 30%, were confirmed with flu. And of those 30, 5 animals, next, 5 animals had received 2 doses before that, and they were around 4 months after their vaccination, so they were getting into that immunity gap. But 25 of those animals, they'd had a booster, and they were on average 8.5 months. So again, more than 6 months since that last vaccination. Next. The same group had also looked at outbreaks between 2007 and 2010. They drew some conclusions from that. Next. And in that, they recounted a number of different measures that could be put in place, and one of those that was recommended was indeed booster vaccination of horses at 6 monthly intervals. So this is not a new recommendation. Repeated studies have shown that it will contribute. Next. So the other thing I wanted to pick up here was really just to say about the recommendation being really important when we have a virus that may well be drifting away from the vaccine, from the strain that is in the vaccine. We know that vaccine strains become outdated over time. That's because of the natural evolution of the infecting strains, phenomenon known as antigenic drift. So we know that antibody levels are also less protective when we're dealing with these drifted or so-called heterologous virus challengers. Next. And we have used in the past mathematical models, and these are always based on data that we've created either experimentally or from the observations that we've taken from the field. Yes. Next. So this slide here really just is a risk model representing what the probability of getting infection with flu is, and how it changes according to how much antibody, which is increasing along the bottom axis there. And here we have 2 lines where we have 2 different viruses infecting, one closely related to the vaccine strain, the so-called homologous, and then the heterologous where it's different. Next. So where we have low levels of antibody represented by the blue line here, actually it doesn't make a lot of difference which infecting virus you have. Your risk of going down with flu is actually quite high because you've not got enough antibody. Next. Similarly, where you have very high antibody, and actually very few animals even immediately after vaccination will actually achieve this, but again, it makes no difference what the infecting virus is if you've got enough high level of antibody. Next. The problem comes in the middle of this distribution, where we only will have a moderate amount of antibody. And what this clearly demonstrates is that the risk is very different between these two according to the amount of antibody that we've got. Much closer to 1 for heterologous challenge, the drifted virus, compared to where we have a closely allied strain in our vaccine. Next. And that can go even where we have moderate to high levels of antibody, we can get this difference in risk appearing. Next. So, as we've been hearing with COVID, mathematical models may or may not be helpful, but where they are actually useful is actually where we're evaluating the effects. What are the differences if we put in an intervention? And in this example next, where we change from 12-month to 6-monthly boosters, we repeatedly see that we will get smaller sized outbreaks from that intervention, increasing the frequency that we boost our animals. Next. And what is apparent also from these models is that becomes especially important for the reasons that you can see on this slide, where we have that heterologous strain of virus, where it is different between what is infecting the animals and what they're seeing with the vaccine. Next. So the last little section I wanted to do is, well, what did we learn about improving the way that we will disseminate information? Dissemination of information is actually really important. The clamour for information is always there when you have a pandemic or an epidemic, or indeed an outbreak. Next. So this next series of slides just highlight actually the way that we used to present our so-called EquiFluNet website, rather stale and texty. Next, we had pockets of text and summaries. Next, maps that weren't particularly informative, other than blobs on them. Next. And in the outbreak in 2019, we were producing these PDF files that were summarizing where we were almost on a daily basis, and they actually became very long and wordy as we went through. So there was a need to improve the way that we disseminated this information. Next. And as we scroll through now, you will see that we actually developed a new online resource as part of our suite of facilities on disease surveillance. Next. And this again is next. You can click through, we can find out more information on outbreaks here. So we created this platform called EquiFluNet, which is much more interactive. It contains all the information that we've got. If we click on that analysis of the UK data now, then we can set date boundaries of where we want to look at outbreaks. Next. And when we run this analysis, we generate these maps allocated again by county. We can generate outbreak curves. Next. And we click on individual counties here. Cheshire, the county where we first diagnosed flu in racehorses. Next. And where we click on those, we can get those descriptions where we're interested in more information. But we've got very visual outputs before that. Next. And we can also look at this at a global level as well. You can see there was flu activity across Europe, in North America, and also quite worryingly some flu outbreaks that cost a lot of donkeys' lives in Africa as well. Next. So we've also turned our attention to how we present data internationally across a wider range of infectious diseases. Next. And so our International Collating Centre has a new platform. Next. So built in a very similar way where you can interact with it. And if we click here on the disease analysis at the country level, and we select under the condition the influenza as a respiratory disease, we set the dates that we want, we can see, and we can click on those countries and again get the same information up through this. Next. And we can also go to a more detailed level, a regional level, where also the data, if it's available, is stored there as well. Next. And again, clicking on Cheshire, we can get through to that information. Next. So really, I just want to wrap up now before a few acknowledgements, concluding remarks. Next. So in 2019, we witnessed probably the largest EI epidemic in the UK and also in Europe for probably 30 years. Almost certainly, I think the low national vaccine coverage was undoubtedly a major factor in allowing this outbreak to be propagated next. And that very much points to the clear benefits from adopting wider vaccine coverage, if that can be achieved, that we may limit the possibility of such large outbreaks in the future. Next. It was also evident that we did see clinical influenza in horses that had been administered vaccines, even those containing what are thought to be the appropriate strains. And there is danger, I think, of significant vaccine failure in due course, because the viruses are forever evolving. And the vaccine strains are from 2003, so some 16 years later now than what's in the vaccine next. So the recommendation very much is that we continue to adopt 6 monthly boosters in order to optimise vaccine-induced protection in our animals, and hopefully we develop this concept of herd immunity. So not all animals will be vaccinated, but by upping the percentage that are, we can protect the entire population. Next. And finally, really just to close off, I really want to stress the importance of disease surveillance, reporting, horse owners and vets investigating when there could be respiratory disease caused by flu, where this is particularly spreading amongst groups of horses. These are really critical elements of detecting disease, controlling it, and also actually future prevention, because we need to understand where those viruses are at and how do they compare with what we've got in our vaccines, and really just acknowledge the flu program that the levy board have been funding now for many years. Next. So before I wrap up, I really just want to acknowledge really the generous support that the thoroughbred industry has contributed to the Animal Health Trust over many years. As I've said, the flu surveillance program, the EquiFluNet element, has been long supported by the levy board. We do receive support through the Equine Infectious Disease Service, not only from the levy board, but the thoroughbred breeders and the racehorse owners, the latter through a race entry levy. And then finally, the International Collating Centre, which I referred to, that's supported by member contributions from the International Thoroughbred Breeders Federation. And at that point, I'll close off and hand over to Celia.
Richard, thank you very much. That was a really fascinating insight and useful to see it all in perspective. I think when we were in the middle of it, it seemed like a major deal, but perhaps in the modern world, we realise that things can get worse. I'm going to hand over to Antony Clements here, and he's going to ask a question.
Hello, Richard, and yeah, well done on an excellent talk with a very thorough description of what went on in the last 18 months or so. I should state that I do sit on the BHA Veterinary Committee with Richard, so I was part of that. Part of the advisory tree. Ultimately, the decisions were taken by the BHA, but we were part of that advice as to what to do. So I was part of some of those decisions. And I think the primary criticism that was levelled at the BHA was the suspension of racing, and whether that was either what you would call an overreaction or a knee-jerk reaction, I believe it was termed. And that was, at the time, seen as totally unnecessary. With everything that we now know, and including what's going on this year, should we in future be suspending racing as a whole while waiting for additional information, or should we just be doing much more selective regional type lockdowns to allow the majority of the population to continue? Because that was, as I say, I think the primary criticism that was levelled last year.
Yeah, that's a really good question, Antony, and thank you for your support on the BHA Veterinary Committee as well. I think we have to learn lessons, and I think we have to look at those criticisms in a mature way and think, well, could we have done something differently? The truth is, I don't think we will ever know. Obviously, and I think I tried to get this over in the presentation, there was a definite sense that something was different in 2019. We had no idea you know, as we went through January and early into February, how big things might get. And where you have a sense that those vaccines may be on the verge of not working, then that is a game changer. So I think it's a matter of looking at the whole thing, and I think maybe in future, as you've suggested, a more localized and regional approach might be appropriate. That racing network is very highly connected, and I think we went through an important learning phase, all of us, as to could we actually do the level of testing that we could in only a few days. And so I think the reality is we probably could have done it differently with some intense testing, very much targeted, but whilst keeping the sport going at the same time. My slight concern is, and I don't quite know what the answer is if we lose compliance in terms of vets and trainers wanting to report when there are issues. And I think the fear is if that goes underground, when it does rear its head, we have a very much bigger problem than if it had been handled in a different way very early on. And I would welcome your thoughts on that idea. I know you're at the coalface in Newmarket day to day.
I think, as you say, with hindsight, we perhaps could have been taking a slightly more regional approach. Although, as you say, when they actually looked at the possible crossovers between yards, one yard effectively was in contact with nearly 180 other yards, which within only a matter of days, and there was a known confirmed positive in a horse that had been to the racecourse with some clinical symptoms. So, as you say, the interconnectedness of racing is quite frightening in a way, and I guess we've seen that this year in terms of COVID and aeroplanes and how how the world works, and higher density countries seem to be slightly worsely affected. So it's easy to say now, yes, with hindsight, we perhaps should have kept it more regional and been a bit more pragmatic about it. At the time, I guess we were looking for information. I think you're right in terms of that, disease surveillance, in that, we need to be looking at ways of creating more testing during the year. And I know it's been looked at in terms of the BHA, but there is still, once you've turned up with your piece of paper saying you've got a flu positive, you then shut your trainer down, and it's an all or nothing step. But if it's not done rightly, then it just allows things to propagate much more quickly. So I think I know we looked at it, and obviously the last sort of 3 or 4 months have somewhat taken hold of things in a slightly different way, but it probably just reconfirmed that we need to be looking at that again in terms of creating a way that people can more easily, not more easily test, but have a slightly easier way to go about testing that has more discussion rather than just a blanket lockdown from day zero. And I don't have the answer to that, and none of us did. But it's certainly something we need to get back at looking into, because there will be more flu. We know that. It's only a matter of time, and we need to make sure that we are better prepared for the next one, whenever that is.
If I could just sort of try to distill into that a little bit more, though, there seems to be a kind of underlying concern that there is essentially undiagnosed flu going on under the radar within the racing population. And while I'm not suggesting that that's impossible, I actually think there's relatively little evidence for that. And mainly because we're dealing with such a highly vaccinated group, the odd instance of flu might go undiagnosed, but where does this concern really come from? I think there's no doubt that there's undiagnosed flu going on outside in the wider world. But is it really a major reality in racing?
Well, I'll allow Richard to answer, but that was one of the concerns levelled at us as the BHA Veterinary Committee, that actually this is normal. And we were unaware of any evidence to support that. And hence, when we started seeing, when we had reports of vaccinated animals in training having clinical signs of influenza, we did not think that was normal, and that's all part of the reason why the decisions were taken. So there were people that expressed a view that there is an underlying endemic level of flu in the thorough racing population, in the vaccinated racing population, but we were completely. As far as we know, there is no evidence to support that, and that ultimately is one of the cruxes of the question: is that the case? In which case, we need to do something about it, or is that not the case? In which case, we should be looking to eradicate flu within the thoroughbred population, which is effectively what we tried to do in February last year. And Richard, I don't know if you agree with that, or...
Yeah, very much so, Anthony, and it is an important question, and we accept that flu in countries such as the UK is considered endemic, which means it goes in cycles, it doesn't actually go away. And we certainly see this when you look through the family tree of these viruses. Whilst Clade 1 is relatively new, it did come here in 2009. But you can see year on year with those Clade 2 viruses, for example, that it never went away. It just was circulating in parts of the population that we probably don't get access to in terms of samples, etc., only occasionally. So I think there are possibilities that there are occasional incursions into racehorses. And we know, again, coming back to the models, that the vast majority of times that flu transmits, it will not actually go anywhere. The chain of transmission is very, very small. And so depending, and bear in mind, racehorses are obviously athletic animals under very close trainer and veterinary attention. And anything that throws that off in terms of disease is going to come to their attention very, very quickly. And I think what I don't believe we are missing is where there are propagating chains of transmission causing clinical flu that will undoubtedly affect performance in racehorses. There are actually a wide range of pathogens that can cause respiratory disease, particularly in young racehorses, and the vets in the training yards, they're in there every day, and they're managing those infections all of the time. And they are aware of the need to do vaccination, and vaccination will have a massive impact on reducing the risks that you actually have an endemic situation within racehorses where it's going around continually within that population. I think it's much more likely that it's occasional incursions and it burns out very, very quickly. And we know from previous years that we can detect those, and then we manage it. But somehow 2019 was different, and we just needed to do a little bit more in order to get on top of it. And like you've said, Anthony, I think there are proposals that we can do, probably with some anonymous surveillance, in order to try and address that question of how common is flu as a cause of those respiratory signs in young racehorses. And I'm going to hazard a guess that most years it's actually very, very low.
So if I could move on to another topic that's sort of, again, thoroughbred specific, and just thinking back to the way that outbreak was managed, I wonder if with your modelling, there were a huge number of nasopharyngeal swabs taken, and there's a cost involved in that. I wonder if on reflection, you could have done rather than the whole yard, is there a way to calculate, a certain percentage? Could that have been done more efficiently? Because it did seem like an absolutely magnificent effort. And I wonder would you do it exactly the same way next time, or could you have done it in a more sort of spot check fashion?
Yeah, it's a great question, Celia. What I should say, and maybe it's sacrilegious to say, but not every swab that got taken got tested, because the capacity was not there to churn every sample. So actually, when we talk about this now accepted concept of test and trace, that's effectively what we did. We just happened to get swabs from everything that was in those yards, and we very much actually targeted the runners that had been because they were deemed as the high risk animals. And then those animals in most of those yards were targeted for testing. Where we had, for example, yards where horses had been in the same race as the confirmed yards had runners, then we tended to do a more wider test of those to make sure we weren't missing anything. So I think you're right in terms of actually going out and testing specific animals. We probably could do that slightly differently in the future, and where those animals come back clear, particularly if they've actually been placed in isolation themselves, because that's one of the important things you can do, is that it's this concept of you've got an animal that's at risk of bringing in an infection because it's been at a race and it's been exposed. If you can manage that case very early on, that sort of self-isolation, as we now call it, then actually you can break that transmission chain onto the rest of that yard. So I think and I know, it's difficult in busy racing yards where, maybe many tens of animals are going out on a daily basis. That can be really difficult. But there are perhaps ways that animals can be managed that just mitigate that risk that you're inevitably going to get transmission on a yard when animals come back.
So I very rarely take nasopharyngeal swabs, but I'm aware of at least one veterinary nose that got broken, and to have to go out and do yard after doing one is enough for me. Anyway, I wanted to move the topic on a little bit to talk a bit more about the second wave, and I was interested in what you showed us about the low vaccination rate here in the UK compared to Europe. And actually, thinking about the reason why we're having this meeting, if you go back into the documents around flu in the 1980s, Gerald Lee was actually very much involved in setting up the funding system that British racing has supported, or the British thoroughbred world actually has supported over the last 2-3 decades. I almost wonder whether one of the problems is that because in the early stages, all the press was about racing stopping, that I know that you can't control messaging, but I wonder if we almost scored a sort of own goal by giving the wider world the impression that this was a racing issue, when in fact, actually, maybe the concept of a second wave will mean much more to people now than it did last year. But if thinking of that slide that you showed us, where the other European countries were essentially able to have one wave and then get it under control, it's very notable that the UK suffered from a massive second wave. And what do you think we can do about that?
Yeah, another great question, Celia. I think you're right. I think racing is so big here that it really did get picked up by the national press, and anything that stops racing is big news. And so yeah, the emphasis may well have been too strong on that. Yeah, I think going forward we perhaps, rightly or wrongly, need to draw the analogies with COVID, and I don't know. We need to press these messages much harder at the grassroots, and I don't know, use social media a little bit more wisely than we have done at the past. I'm probably not the right age to be doing that, but just there probably are ways that these messages can be put out more smartly, to direct at the right audience. And use the example of COVID and what happened with flu in 2019, and draw those analogies to show that actually, we perhaps could have done things differently if people had adopted it slightly earlier and done what the other countries managed to do. But they need to invest in it longer term, and that's what racing has done. It's a huge investment to bring in a mandatory vaccination program, and I just think there are some parts of the horse sectors that are just not ready for that, unfortunately. And it is one of the costs of ownership. The privilege of owning a horse should be part of buying into responsible herd health, and perhaps that's a message we need to be pushing much more. I don't know what the effect, if there is a financial downturn on horse ownership, and obviously the downstream welfare issues that would be a concern there. But as and when we come back and out of that, then messaging about responsible ownership needs to include messaging about vaccination, surely.
This is not a lesson that should have been learnt from the 2019 outbreak. It's not that if the UK horse population had been better vaccinated in 16, 18, then maybe we wouldn't have been quite so hard hit in 19.
Just to agree, I think it's been a long-term problem, getting that percentage of the total population vaccinated up, and also sustaining it. I mean, often we will see after other different types of outbreaks, there's a clamour for vaccination, but then it soon goes down the priority list and it starts to get dropped because people don't perceive it as a problem. And you end up with this vaccination paradox, which unfortunately we see with our children as well as our horses, that outbreaks and endemics will drive vaccination, but they then will fall away with time as the memory fades.
Fred, do you want to comment?
Richard, thanks for your comment. I've seen amongst some of my clients at the moment who are primarily in the non-thoroughbred world, who feel that because of COVID and their horse is not moving anywhere, there is no need to booster because there's no exposure. The horses are not being exposed to competition or to county fairs or whatever, and therefore a 6 monthly booster, whilst they were very enthusiastic about the idea a year ago or 6 months ago, is fallen by the wayside. So I'm a bit concerned that we are already in a phase in the non-thoroughbred world where people are losing their enthusiasm to have their horses correctly vaccinated and are following your very good recommendations, which, as you say, is not a new one, to booster every 6 months.
Yeah, no, I think those fears are very, very much there, Fred. And it's interesting to get that reflection. Obviously, people have been entirely diverted, quite rightly, by COVID. But as you say, one of the consequences of that will be the proportion of the population that's managed to maintain that more frequent vaccination. And again, I'll just go back to that slide that mapped the proportion of the different outbreaks that the different countries had in the last 3 months. And the UK, it's small at the moment, but it's still there. The viruses, as we know, will take advantage of the situations that they find themselves in. And if the overall pattern is that as horse activities resume, we get mixing and mingling, if the events have not heeded the advice about bringing in vaccination requirements, then that will provide ideal conditions for a virus such as this Florida Clade 1 to take off again. And the danger is, as you've said, that if we've allowed those well-intentioned vaccinations in, halfway through 2019 to completely lapse and not be boosted in the meantime, then we may well be reducing the population back to the susceptible. And if we provide the conditions through events, and there will be a clamour for events. We're seeing it, with racing, a lot of, 10 race meetings at Newmarket for however many consecutive days, a lot of horses, congregating. Then the risk is that we will get explosions again. And if the lessons that hopefully I've outlined are not heeded.
Nick, do you have some reflection?
Rick, I'd just like to say thank you for your presentation and for the huge amount of work that you've done over this and other diseases, and it also emphasises the importance of the disease surveillance work that you head up and the importance of it in the future. Just two things I would like to say. How do you think this new strain arrived in Europe? Have we got any idea of how that happened and how we could possibly stop that happening in the future? And you mentioned the reservoir of influenza in birds and wildlife. How much monitoring of those viruses is going on around the world?
Okay, thank you, Nick. Yeah, I didn't touch on it there. Florida clade 1, its sort of natural reservoir is in the Americas, particularly actually North America, but it does, you know, it's had activity in South America as well. I think some people possibly thought that this may have come in with horses from South America. Interestingly, there was some activity around this in I think it was 2018. There was a bit of a fear that polo ponies may bring in flu from I think particularly Argentina back in 2018, and we did raise awareness and we were helped actually by DEFRA. We actually think this probably came from North America, looking at the viruses. How it got into the UK, we can't say. It's clear from what we know now that there was activity in Europe, certainly in the latter part of 2018. So it may have got into the UK through a European contact. But in terms of how it got into Europe, again, that pathway is not altogether clear, but there is obviously quite a lot of horse movement between North America and Europe, and we think it came in through that route. And yeah, I think more could be done in terms of safely handling animals that come in, effective voluntary quarantining of North American imports. It's a recurring theme, I'm afraid, going back several decades, that new viruses come in and then establish themselves and actually see off what we had before. We've seen it before with American viruses taking over European and what have you. In terms of bird flu, obviously there, you know, we hear periodically of large outbreaks of bird flu. There's obviously a real zoonotic risk with avian flu as well. So I think there is a lot of monitoring going on. How much is going on in the wildfowl? Again, I'm not altogether certain, but as that is the main reservoir, I'm sure that is being monitored, and they do seem to get a handle on what the origin of certainly the human viruses has been, and obviously we do worry about mixing of different viruses, swine flus and avian flus, creating new pandemic flus, and there's a lot of effort going into that. And whilst COVID has diverted a lot of attention, you know, we really do worry about what the next flu season will bring. And are we missing the mark there in terms of vaccination of humans and everything? So we can't let our eye off that ball of what avian flu is doing.
Richard, thank you very much. I just wanted to point out, I am entirely on board with the idea of improving your communications with the outside world, but I really liked your PDFs that were produced. So can't thank you enough for all your efforts during the problems we had back in 2019, and thanks for reflecting on it all for us now.
Thank you very much, and thank you to yourself, the organisers, and Beaufort Cottage Educational Trust for inviting me. I've really enjoyed it, and hopefully everybody that watches will take something away from it. Thank you very much.